Minister, the Leamington District Memorial Hospital Board of Directors is being forced to close Leamington's obstetric units due to a lack of funding. This closure will result in the firing of up to 40 good-paying jobs, including registered nurses. Keep in mind, Minister, Leamington is still reeling from the massive job losses that hit this community earlier this year. This places Leamington's economic recovery in jeopardy, but more importantly, it puts the health of local residents in jeopardy. Mothers going into labor will now be forced to make the long drive to Windsor. With millions of dollars spent on middle management in health care, why is there no room for Leamington's vital clinic?
Well, and thank you, Mr. Speaker. I'm happy to speak to this issue again, and I do understand that Leamington District Hospital, that the board has made this difficult decision to, on a go-forward basis, the recommendation to close the obstetrics unit, or at least certainly certain elements of it, that being the birthing of children. Many aspects of the Leamington obstetrics program, gynecological program, the board has considered and will wish to retain. The next stage of this process, as it should be, Mr. Speaker, is that the local health integration network of that region be involved. They are involved, Mr. Speaker. My office has been in regular contact with them. There is, as I mentioned earlier, a public meeting next Wednesday to give the opportunity for the public to be heard on this important issue to the people of Leamington.
Thank you. Supplementary.
Thank you. Back to the Minister. The sustainability of healthcare in rural communities has to be looked at through a different lens. Minister, I understand that LDMH has in fact submitted a proposal that would incorporate midwife and OB/GYN programs that have already been acknowledged as a unique and viable program. However, the Erie St. Clair Lynn has not provided the support needed to move funding of the program forward. This Lynn has cut $2 million in funding to LDMH. Health system funding reform is closing rural hospitals. Your ministry is putting mothers and families at risk by not providing this funding in order to keep obstetrics in rural hospitals. And by the way, Minister, LDMH has provided excellent health care in the community since 1956. My question to you is, why has this government broken its promise to make its decisions through a municipal lens?
Thank you. Minister.
Well, thank you again, Mr. Speaker, and I think the member opposite needs to talk to his colleague from Bruce Grey, Owen Sound, to see what we are doing with our rural hospitals. I was with him a number of weeks ago in Markdale announcing that the government will be constructing a brand new Markdale hospital in that small rural environment, Mr. Speaker. So the truth is the opposite of what the member is trying to portray. With respect to Leamington Hospital, Mr. Speaker, the services that will be retained, in fact, the board of the hospital's argument for closing obstetrics was partly because the volume of deliveries isn't sufficient to maintain the effectiveness of that unit. Roughly half of the women in Leamington currently are choosing to deliver in Windsor Regional Hospital in Windsor, Mr. Speaker, but the gynecological services will be retained. The pre- and post-care services as well be retained. In fact, they're adding beds. The proposal is to add beds at Leamington Hospital in acute care and other aspects to more accommodate the needs of the region, Mr. Speaker.
Thank you. Your question?